Good day, everyone. My name is Honorary Victor. I am a neurology applicant and I will be doing the Ching Cheng's comprehensive review of clinical neurology. We've done questions 1 to 43, and right now we'll be doing 44 to 46. So let's get started. Questions 44. Regarding the vestibular sensory organs, which of the following is correct? A. The ampulla is located within the saccule. B. The autolytic organs are more sensitive to vertical motions of the head. C. The semicircular canals contain cornea that are involved in detecting motion. D. The ampulla is located within the utricle. And E. The semicircular canals are considered autolytic organs. Now, let us briefly talk about the vestibular sensory organ. Now, the vestibular sensory organs consist of two things. The first is the autolytic organs, and the second is the semicircular canal. So, two different things consist of the vestibular sensory organs. They include the autolytic organs and the semicircular canals. Now, when we talk about autolytic organs, we are looking at two things. They include the saccule and the utricle. And these two organs are actually expansions of the membranous labyrinth. Now, within the saccule and utricle, as you can see in this picture, is something we call the macula. And this macula is basically a layer of hair cells that is overlain by a heavy gelatinous autolytic membrane. And this autolytic membrane is actually covered by calcium carbonate particles or crystals. And these crystals are things we call the autocornea. Now, when the head moves in linear acceleration, it actually moves relative to the autocornea, and this results in bending of the hair cells, and subsequently that leads to a change in neuronal activation. Now, the autolytic organs actually detect linear and vertical motions of the head relative to gravity. So that's for the autolytic organs, which includes the saccule and the utricle. Now, for the semicircular canals, there are three of them, and these three are actually on each side of the head. They stay at right angles to each other, and they are tubes of membranous labyrinths that extend from each of the utricle. So basically, they come out of the utricle. Now, there are two horizontal canals, there are two vertically directed anterior canals, and there are two vertically directed posterior canals. Now, within this semicircular canal, there's something we call the endolymph, and each canal actually dilates at its base, forming what we call the ampulla. Now, each of these ampulla actually contains sensory hair cells, which are embedded in a gelatinous cap called the cupula, and they do not contain of the cornea. Now, during head rotation, inertia will cause the endolymph that are located within the semicircular canal to lag behind and push on the cupula. And similar to the autolytic organs, this bends the hair cells and causes neuronal activation. Now, the semicircular canals are actually more prone to angular motions of the head. Now, information regarding head movement is transmitted to the ocular motor nuclei, which results in eye movement in an equal magnitude and opposite direction to the direction at which the head turns. And this actually allows your eyes to remain stationary in space despite you moving your head. And we call this phenomenon vestibulo-ocular reflex. Now, if your head moves in the direction of the semicircular canal, it will activate that canal and the correlative extraocular boson. Now, your vestibulocular reflex actually keeps the line of sight stable in space while the head is moving, and this makes sure that your eye is focused on one object when you shift your head back and forth. And this actually occurs because each semicircular canal has an excitatory and an inhibitory projection to the agonist and antagonist extraocular muscles. Now, if you move your eye to the right, what happens is that this activates the horizontal canals on the right, and this will cause activation of the medial rectus in the right eye and the lateral rectus on the left eye. At the same time, this will also inhibit the lateral rectus on the right eye and the medial rectus on the left eye, and thus it enables your eye to stay in one place or to remain fixed on an object despite your head movements. The cold calorie testing is helpful to assess brainstem integrity, which helps to define whether brain death has occurred. And this is a passive way to actually test the vestibulocular reflex. It should be done using cold water at 30 degrees and by bringing the head of the bed to 30 degrees from the horizontal position in order to bring the horizontal canal to a more vertical plane for optimal testing. The temperature difference between the body and the infused water creates a convective current in the endolymph of the nearby horizontal semicircular canal. Now, warm and cold water would produce currents in opposite directions and therefore a horizontal nystagmus in the opposite direction. When you instill cold water, what happens is that the endolymph actually falls within the semicircular canal, and this decreases the rate of vestibular afferent firing, and both eyes will deviate towards the ipsilateral ear. Now, so basically what happens is that you have cold water being instilled in the right ear, and when you have that cold water, this kind of turns off the semicircular canal on the right ear. And remember, when you turn off the semicircular canal on the right, what happens is that the medial rectus gets turned off on the right and the lateral rectus gets activated on the right, and on the left the medial rectus gets turned on and the lateral rectus gets turned off. So the eyes actually move towards the parts where you are instilling the cold water. Now, in a healthy person with a normal functioning cortex, following a latency of about 20 seconds, nystagmus will appear and persist for up to 2 minutes. And the first phase of this nystagmus reflects the cortical correcting response and is directed away from the side of the cold water stimulation. So, if cortical currents are impaired, that is, in a patient who is comatose, the nystagmus will be suppressed and will not be present, and only tonic deviation will be evident. And that means that the patient actually has an intact brainstem. And the opposite will actually occur when there is warm water. So the nystagmus is actually named in the direction of the first phase, and there's actually a fancy mnemonic for this. We call it cows. Cows as in cold, opposite, warm, same. And this is basically in the direction of the nystagmus. So for cold water, the nystagmus is to the opposite direction of the cold water stimulation, and from warm water, the nystagmus is towards the warm water stimulation. So let's go back to our questions. So 44 says regarding the vestibular sensory organs, which of the following is correct? So the first one is the ampulla is located within the saccule. That is false. We know that the ampulla is just underneath the semicircular canals and the actually projections from the utricles. We have B, the otolytic organs are more sensitive to vertical motions of the head. That is true. The otolytic organs are usually sensitive to linear motion, vertical motions of the head, and that's to do with gravity. So that's true. But let's look at option C. The semicircular canals contains otoconia that are involved in detecting motion. That's false. Remember that the semicircular canals contains endolymph, and endolymph are what moves and then activates the copula that are found within the ampulla. Yeah, so that's false. The otoconia are usually found in the utricle and the saccles. So D, the ampulla is located within the utricle. That is false. The ampulla is underneath the semicircular canals, which are projections from the utricle. And then lastly, the semicircular canals are considered otolytic organs. That's false. The semicircular canals are considered vestibular sensory organs, and the otolytic organs include the utricle and the saccles. So options B is the right answer. Okay, so for question 45, which of the following is correct regarding the vestibuloocular reflex when the head is turned to the right side? in a purely horizontal plane, while the eyes are focused directly ahead on an object. So remember what we said? The head is turned to one direction, so this time to the right side. That means that the right vestibular apparatus, the horizontal canal, is going to be active, or the right horizontal semicircular canal is going to be active. And when that happens, the medial rectus on the right eye will be activated, and the lateral rectus on the left eye will be activated. So the right medial rectus will be inhibited, that is false. The left lateral rectus will be activated, that is true. The right superior rectus, that's false. So anything superior, inferior, or whatnot are false. It's going to either be the medial or the lateral. So this option B is correct. So for question 46, you are consulted on a comatose 79-year-old man who was found at home for an unknown amount of time. On the basis of cold calorics, you suspect that he is not brain dead. If the cold water is infused into the left ear canal, which of the following responses would not be expected in a patient with intact brainstem? So we have a patient who has an intact brainstem, and this patient is comatose. So we're saying which of the following is not to be expected. So remember, in this patient, you put in cold water in the left ear. What do you expect? You expect that you're going to kind of deactivate the vestibular apparatus on the left ear, and the medial rectus on the left eye will be deactivated. The lateral rectus on the left eye will be activated. The medial rectus on the right eye will be activated. The lateral rectus on the right eye will be deactivated, and the eye will move towards the left. So the left lateral rectus will be activated. That will actually occur. B, there will be tonic division of the eyes to the left that will actually occur. C, the right lateral rectus is inhibited. That will actually occur. D, the right medial rectus is activated. That will actually occur. And E, there will be slow conjugate movement directed to the right. That is false. There will be a fast corrective saccade to the right. So option E is the false answer, or which is the right answer in this case because it's not expected to occur. So that's option E. So that's all for this episode. Thank you for listening. See you in the next episode.